A veteran shot in the face at a park 13 years ago will finally have something to smile about tomorrow. Eyewitness News reporter Matt Boone spoke to him and shows us how a local dentist is helping it all come together. Matt.
Courtney, Billy Moore was in the Navy just as the war in Afghanistan was heating up, but it wasn't until he was back here in Bakersfield that he ended up in the line of fire, changing his life forever. It's early September of 2002 when Billy Moore had just gotten home on leave from the Navy.
I've been doing a little bit of dove hunting and deer hunting, just kind of a little bit of everything.
But first he had plans to meet a few friends at Liberty Park.
I was looking for trouble, just sitting there trying to catch up.
But trouble came looking for them, two men coming up, questioning Moore, thinking he was someone else.
You could tell he was trying to get, catch the nerve to start something, and then he came back with a couple more guys.
The conversation was heated, but Moore says no fight broke out. It wasn't until the men started walking away that suddenly
my head was just thrown back against my seat, and I instantly knew, because I tried to say something, I got shot, and my teeth just went, and there were just hundreds of pieces just all over my dash.
Moore was able to drive himself out of the parking lot and was eventually taken to the hospital.
I went into survival mode.
Miraculously, he survived, the bullet stopping less than an inch before his spine.
The doctor was like, man, I can't believe you just got shot in the face and we're letting you go. There's really, you should be dead or paralyzed.
But that began a long medical recovery process. Moore says despite repeated attempts and promises, the VA hospital never followed through.
I've gone as far as where I was actually sitting at the VA's office, sitting in a chair, getting ready, thinking I'm finally going to get seen, and then the guy come and say, oh, actually, it's not coded this way, and then turned away.
Dealing with that new reality wasn't easy.
I was in a pretty bad depression. I mean, I didn't want to talk to nobody. You look in the mirror, you just constantly looking in the mirror, and you could see there was a big old hole right there in the scab, and you're just like, and you pull your lip down and just look, and it's like, gosh.
That's where Dr. Donald Trunkey comes in.
We were looking for a story that would be interesting, but we had no idea that would be this interesting.
His office recently began a community competition where potential patients could send in their stories, the winner receiving free dental work.
It took our breath away, especially after I took the 3D image and we saw how close this bullet was to his spine.
Ironically for Moore, after 13 years, he's almost gotten used to it.
I have a lot of people that are completely supporting it, and then I have other people it's kind of your identity now. You got that little smirk, that little grin.
But even though it's become familiar to him, it's become an unwelcome conversation starter.
Hey man, what happened to you? Are you chewing? Or you got to chew? Or, what happened to your face? There won't be any more of that. That's going to be the nicest part.
As for Dr. Trunkey,
what's going to really be exciting is to watch Billy go like this and look in the mirror and see the smile on his face.
The first surgery is scheduled for tomorrow morning. A second operation will take place in about 3 months. We'll be sure to keep you updated when he heals up. In studio, Matt Boone, Eyewitness News.